traditionally are J-curve knees. People have kind of improved on those. The manufacturers have improved on those, but the medial pivot is still the only constant radius medial knee that conforms significantly with the tibial polyethylene on the medial side. It's got the conformity that results in stability. So the stability throughout the full range of motion is what's achievable with this constant radius.
The aha moment for me to choose the medial pivot knee, or at least try it, was that to me every other design on the market, at least at that time, and still, other than a few small different approaches, were symmetric knees that, to me, in a large number of, or a number of patients, had either good motion with a lack of stability or good stability with a lack of motion. And I really got the impression that this would provide a good combination of stability and motion because of the ball and socket stability, focused medial side, and the asymmetry on the lateral side, and that's what I found it to be.
In a lot of ways, it's kind of brought up the game in terms of knee replacement. I think the results that we're looking for are now at a higher level. We're doing knee replacements at younger and more active patients all the time, and I think this fits perfectly with the demographics. We're giving them, I think, a more normal feeling knee, and that's exactly what the younger, more active patients are looking for. In the past, when we were doing surgery on older patients with maybe much less demand and much lower expectations, I think we could tolerate knee replacements that didn't function quite as well. But so this fits perfectly with today's population. I think obviously that's going to continue going forward.
When compared to traditional implants, my patients have started to pursue more active lifestyles. I trained in the Midwest, and people were not as active, so they didn't complain. When I came to San Diego, where there are hills, patients started to complain, specifically going downstairs, hiking. They weren't as painful with the medial pivot knee, but more importantly, their endurance started to increase to the point where it was stronger and had more endurance than their natural knee. That's a testimonial that I just did not expect. And that's what excites me, because most of my patients are playing golf and they're pursuing sports.
Yeah, the biggest eye-opener actually was that I have two PAs that work with me, and without looking at x-rays and without knowing which case that they were involved with, those PAs can sit down in front of the patient, they can examine them, they can tell instantly whether or not they have a medial pivot knee or if they have a PS knee that I was using previously. There's a big difference on the examination, and I think the patients, the way that they walk, we see that too. We see them getting rid of walkers, canes much quicker. They just feel like the knee feels more normal to them, which is a great thing, especially for an active population like we're dealing with here.
So in 2005, I did a fellowship in Marseille, where I had to use another knee system, and I was quite happy with that. And when I came back from Marseille to Ghent, I worked together with a colleague who had already more than 7-8 years experience with the medial pivot, and he asked me to try this out and to see what the results were. And then I was not so convinced, because I had good results with the implant I used during my training. But then I did a couple of them, and I saw them back at 2 months. And to my surprise, the people were more rapidly rehabbed than I was used to. So I completely switched to this design since 2005, 2006. And I never came back. So I'm still a user of the medial pivot, and I will continue to use that system. My patients love it. When they encounter patients that were not operated by myself and by other surgeons that used different kind of implants, and they listen to what these patients can do during their free time, they are not able to do all these activities that my patients can do, and that's a fantastic thing with that implant.
So there are other companies that are cropping up with medial pivot knees now. They're not the same, so it's not a one-size-fits-all. The MicroPort medial pivot knee has 20 years of experience, and with that experience comes the subtle things that make it successful, such as the type of poly that's used, the locking mechanism that's used, the single radius of curvature, Other companies have medial pivot by design with conformity on the medial side, laxity on the lateral side. And that confirms that the MicroPort medial pivot knee is so successful. But be aware, make sure that the poly is exactly the same. Make sure the locking mechanism is exactly the same. And if it's not, my recommendation, stick with what's worked for 20 years, and that's the MicroPort medial pivot knee.